Doesn't sound so legal to me to switch you, a retiree, from Medicare to Medicare Advantage without your consent or knowledge.
We have since filed 3 separate litigations against the city of New York. So you could retire like us 20, 30, 40, 50 years ago. And now all of a sudden you're getting a letter in the mail saying, the city of New York just forced you into a Medicare Advantage plan. You're going to love it.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Hey, it's Jordan. Delighted to be joined by Marianne Pizzitola. You are the president of the New York City Organization of Public Service Retirees. And obviously, health insurance industry and the predatory aspect of it has gotten a lot of focus recently in the aftermath of the shooting of the United Healthcare CEO. And I've been reporting extensively on what sure seems like fraud to me. So we connected because we actually covered some protests you and others have done in New York City. You've been basically fighting for years against retirees being forced off of their traditional Medicare plans onto the more privatized Medicare Advantage plans. So let's break it down from the beginning. When did this start? How did retirees who obviously paid their whole working life, public workers in New York City, to then get Medicare, how did you learn you were being essentially hoodwinked into Medicare Advantage?
We learned in the press. An article appeared in the newspaper that there was contentious fighting amongst unions, and there's over 100 unions in a municipal labor committee, which is an umbrella organization of unions in the city of New York, and that they were negotiating to force all retired labor into Medicare Advantage plans. We were aghast when we read this article because the time was 2021. We were in the middle of a pandemic, and we couldn't understand why labor would force us into privatized Medicare. And then we found out that the Mayor's Office of Labor Relations had made a deal with the unions that if they, two of the largest unions in the city, that if they were successful at forcing the municipal workforce and current retirees, which under New York state law are not in unions, actually that's a federal law under NLRB, you cannot be in a union if you're retired because the needs of a retired person are materially different than those of active workers, that they would give them a raise. And we started to push back on this, like, why are you agreeing to this? And one of the first comments we got back was the United Federation of Teachers Union hadn't had a contract in 9 years from under Bloomberg. And when de Blasio came into office, he wanted to give them a raise and told them they had to fund it. And so they decided that they wanted to give healthcare givebacks to fund their contract. And we were really shocked that why would you give up your health care for a raise? And they did. They did.
So I have it right. Essentially, the city was offering unions for a bump in pay for active workers. We'll do it off the backs of retired workers, most of whom are elderly. So that's how you'll get your raise. We'll just switch people to Medicare Advantage. The retirees, they'll have to pay more. But the city surmised it would save money by switching retired workers to Medicare Advantage.
Yes, and let me explain who retirees are. You're correct. Elderly, so over 65. My oldest retiree is 102. The disabled, 9/11 responders, line of duty widows and widowers, and our disabled children. That's who's on Medicare.
And the city, I failed math, but I guess it thought it would be saving money if they switched retirees from Medicare to Medicare Advantage, because with the traditional Medicare, it doesn't cover 100%. So the city traditionally had to pay the rest of it to cover retirees' expenses.
Correct. So Medicare covers 80% of your medical bills, leaving the last 20%. That medical bill is covered, that part, that 20% that Medicare doesn't cover, is covered by a supplemental or Medigap plan that the city offers. Under city statute that was passed in 1967 called Administrative Code 12-126, the mayor at the time, Mayor Lindsay, wanted to give health care to employees and retirees. And so when this statute was passed by the city council at his request, that the law reads that the city will pay the full cost of health coverage up to the HIP HMO, which was actually a healthcare plan, that became the benchmark of what the city had to pay up to, that a previous mayor had created to give employees health benefits. So the city had to pay up to this benchmark for every employee, retiree, and their dependent. In the decades of service, our generations gave up wages in order to get like this deferred compensation, if you will, of a pension and healthcare. And so now we were watching our younger generations throw that away, literally on our back, saying, we're going to put you in these privatized for-profit Medicare Advantage plans because they're telling us we're going to get a raise. And they're telling us it's the same and it's better and it's got perks, it's enhanced, it has benefits that Medicare doesn't have. And so we're going to stick you in that and we're going to get a raise for our active workers. And that's how it started.
And I know this is the United States, so laws don't apply to everybody, but that doesn't sound so legal to me to switch you, a retiree, from Medicare to Medicare Advantage without your consent or knowledge.
The city has reneged on a contract it had with us when we were active workers. The bargain was sacrifice wages now, but when you retire and when you need it most, you will have publicly funded, premium-free, quality health care. Yesterday, with one stroke of his pen, and no doubt to preempt this rally, the mayor broke that contract with us and instead signed a contract with Aetna.
Are there not laws on the books against that?
So glad you asked that question, Jordan. We have since filed 3 separate litigations against the city of New York. And the first one was in August of 2021 to stop them from forcing us into a Medicare Advantage plan. Before I go into our litigations, I want you to know that in 2003, a law had been implemented that was passed on the outgoing Clinton administration, was implemented under President Bush, that allowed for, quote unquote, seamless transition from any employee or retiree or union, a former employer who had an EGWIP, employer group waiver plan, to seamlessly transition those people into Medicare Advantage. So you could retire like us 20, 30, 40, 50 years ago, and now all of a sudden you're getting a letter in the mail saying, the city of New York just forced you into a Medicare Advantage plan. You're going to love it. And so now knowing that there was a federal law that granted these sweeping provisions to the secretary that he doesn't have to grant, but they do because of the insurance lobby. And then our own mayor and our former unions were agreeing to it. And that was probably the most heartbreaking thing to know, because our generation, knowing the history of healthcare, it was labor that helped pass the Medicare Act in 1965. So we sued, and we've been suing since 2021. We have 3 different cases against the city. We have won 11 times across 3 different cases. The first case, literally on December 17th, we got a decision from the highest court in the state, the New York State Court of Appeals. We've won all 3 levels, unanimous decisions in both appeals courts. That case is finished. That case defines what the city has to pay for our healthcare. When the mayor couldn't force us into Medicare Advantage, he decided to then impose these co-pays on top of us for the first time in 60 years, $15 for every single service and every test that we take. So now retirees from my generation don't make a lot of money. I'm District Council 37, AFSCME International. Our retirees, again, retired 20, 30, 40, 50 years ago. For example, I'm retired EMS. My pension's $35,000. Most people who retired under DC 37, and 2/3 of them, their pensions are under $25,000. 1/3 of them make under $12,000. So you put copays now, which just started 2 days ago. We had an injunction. The judge lifted that injunction because the city corrected the contract, permitting them now to charge us. These copays will amount to a car payment on many of the most infirm. It's basically a penalty to be using your health insurance. And then
we're talking about doctor's visits and medication?
Medication's completely separate. That benefit's provided by your union if you have one, and if you're managerial or legal or former commissioner, you have to purchase your drug plan from the city or on the marketplace. So that's completely separate. Prescription, vision, and dental are provided by welfare funds. This is strictly
people might say, well, $15, that's not a lot, but if you're still living in New York or anywhere, frankly, at this point, with groceries, utility bills, housing. I mean, I get emails all the time from elderly. I'm on SSDI. I barely can make rent. So that's not insignificant that you would have to pay that.
No, think about, I have a retiree who's in her 80s. Her name is Sally. She was a crossing guard for many years. Her pension is just under $1,000 a month. Now, she has to live with a granddaughter. She can't afford rent in New York City. Rent in Brooklyn's about $3,500 a month for a closet, plus food, plus groceries. How's she going to do that? Now, copays, this becomes, it's really predatory for our own unions to have done this to us. They're not seeing us. They're not seeing that this population doesn't make what they make. We're not making six figures that we could afford a $15 copay. If you say $15 copays, people go, well, that's not a lot of money. Well, to us, it is. As a $35,000 pensioner, and I'm a World Trade Center person, if I have to keep going to the doctor for some things that are covered under the World Trade Center program, but some things that are not, that's copays on me. That means every time I go to the doctor for lung treatments or my monthly infusions, this is going to start to add up if it's not yet certified by that program. These people who make less than me, Sally, who makes less than $1,000 a month, retired police and firefighters who retired in 1979, their top pay in that year was $15,000. So if they take a 50% pension, 50, with cost of living increases a year, you're only looking at 1 to 3% of the CPI compounded over those decades on the first $18,000 of their pension. Today, they make about $26,000 pensions. They can't afford copays. This is what they did to get a raise.
And also, it sounds to me like a bait and switch, because when you were working, whether you were EMS or a teacher, so you're a public worker in New York, if you're working age, you're technically, your Medicare that's taken out of your check is going to pay for the elders at the time. That's how it works on the state level. So you paid to fund, your elders when you were active, but then when you became the elders, the rug is swept. I mean, that's fraud. It's bait and switch.
We've been fighting in New York City for 3.5 years. Mayor Adams always has the money to fight us in court. He's using our taxpayer dollars to continue to fight. He's appealing. He's lost 9 times. And we are calling for Mayor Adams to stop this malicious attack on municipal retirees.
Kind of like in society, respect your elders. Not so much.
No, and actually, it's funny that you use that terminology. When Eric Adams was candidate Mayor Adams, like as a candidate, he said when de Blasio was trying to do this and we approached him, he said, that sounds like a bait and switch. That was the cover of the New York Daily News. This is my healthcare. I'll have to look into this. And then as soon as he got into office, bait came the switch.
I don't know if there's a way of knowing. I'm sure there's plenty of lobbying coming his way, but like, what's in it for him? Because he's losing in court, but the city keeps appealing. Is there direct donations he's getting from the health insurance companies? Is he just listening to bureaucrats around him?
I honestly, I wish I could answer that. You know, you take that motto, follow the money. We've looked through New York City campaign finance. We're not seeing donations by Aetna Insurance or big insurance companies. Could they be hidden? Of course they could. We know that he's already under investigation for straw donation. So I honestly, I can't answer that question. But he'll constantly defer to his Office of Labor Relations, which is the mayor's Office of Labor Relations. And there's a commissioner there. And one of their labor negotiators is Bob Lynn. Bob used to be the commissioner of labor relations. And when he retired, he took a job as a consultant for the same office he retired from, giving himself a $500 an hour consulting fee. And then he went and negotiated these deals that did this. He's been trying to destroy the city administrative code that provides for the city paying for healthcare since he started working for the city. He has been trying to get rid of this since under the Koch administration, which brings you back to the 80s. It would then reduce the cost to the city by passing cost on to workers and retirees, which is exactly in violation of what the mayors, both Lindsay and Wagner, tried to put in place, was to give access to healthcare to workers, retirees, their families, and not have them pay for it. They were very progressive for the time.
Right. I'd like to read this to you too, because in addition to the financial problems, Medicare Advantage, it seems a lot of these health insurance companies are creating fake diagnoses to make more money, which is probably not safe if you're a senior. It's from the Wall Street Journal talking about United Healthcare. Like most doctors, Nicholas Jones refers to diagnosed patients after examining them. When he worked for United Health Group, though, the company frequently prepared him a checklist of potential diagnoses before he ever laid eyes on them. United Health only did that with the Eugene Origin family physicians' Medicare Advantage recipients, he said, and its software wouldn't let him move on to his next patients until he weighed in on each diagnosis. The diagnoses were often irrelevant or wrong, Jones said. United Health sometimes suggested a hormonal condition, secondary hyperaldosteronism, I mispronounced that was so obscure, Jones had to turn to Google for help. Quote, I need to look it up. Moving on, sickness scores for those United Health patients increased 55% on average in their first year in the plans. That increase was roughly equivalent to every patient getting newly diagnosed with HIV, the virus that caused AIDS, and breast cancer. The analysis showed that far outpaced the 7% year over year rise in the sickness scores of patients who stayed in traditional Medicare. But apparently the higher the sickness score or, the more severe diagnoses or the more diagnoses the doctors gave, the higher the payouts. So that does not seem, necessarily safe because you could be provided unnecessary medication, unnecessary treatment.
This is called upcoding, and insurance companies do this data mining all the time. There's another group of retirees that I'm helping in the city of New York that are not covered under the same statute that I am. They are the New York City transit retirees. They have to have a separate litigation because they are quasi-state employees. They are struggling to finance their litigation at this time. They were forced onto Aetna Medicare Advantage by Transit Workers Local 100, January of 2024. There's horror stories coming out of this all over the place. And what they're facing with on a daily basis is between 1 and 5 phone calls a day from Aetna, trying to come to their home to do a healthy home visit to say that, oh, we care about you, let us come to your house. That is an upcoding attempt. They want to come and talk to you about your health care, about your prior health issues, your any diseases you may have had, because then they can go back as they're leaving your house and go, hey, Medicare, I went to Marianne's house and she's a higher risk. We're going to need more money. And that's what they do. So it's frustrating.
Could you share, because obviously other retirees have been out there in the streets protesting, that of, can you share any difficulties or horror stories of your, former colleagues or, current retirees?
So my retirees in New York City, retirees that are employed by New York City, city civil service, we have so far been able to stop the mayor from forcing us into Medicare Advantage. These transit retirees, however, they're in a different situation. So one of the gentlemen, he lives in Arizona. His name is Lewis. Lewis has prostate cancer and joint disease. We did an article with him, and he was also a guest on our labor radio show. And he said that he goes to Mayo Clinic. Mayo Clinic does not accept Medicare Advantage in Arizona, actually in all of their locations. And what they said was you'd have to find another doctor or hospital to treat you. So he ended up having to drive an hour further away. Now, mind you, Lewis is in his 70s. He had to drive an hour further away to find a doctor that would do his in-network, that would do his joint injections. I have another lady who lives in Texas. She had to move there to take care of her grandchildren. She too is up there in age, between late 60s and 70s, I believe. And her doctor wanted her to have an implanted defibrillator. Aetna told her, no, you can't have a defibrillator unless you wear this life-saving vest for 90 days. Then have an echocardiogram. And if we determine that you still need this defibrillator, we'll let you know if we find it medically necessary. So Hurricane Beryl happened to come through the region, and she lost her electricity for over a week. She called me after I couldn't get in touch with her for a couple of days. She finally called me crying from her car saying, like, I don't know what I'm supposed to do. This vest keeps beeping. Now it's not making any noise. Well, of course it needed to be charged, and she had no electricity. And she was calling me from her car because she was charging her phone in her car to talk to me. So this isn't healthcare.
Yeah, this is exploitation and sounds like fraud. And there's another element to this. I mean, I think it's been a good thing in recent years, seeing all this union organizing, the Amazon workers, the Starbucks workers, teachers on strike, UAW. But I mean, clearly in this example, the local unions are kind of, robbing Peter to pay Paul. They are selling out the retirees to get a boost for their active workers. Well, what is the point of being in a union when you're working if you have no certainty when you're retired? I mean, I remember interviewing UAW retirees. Their pensions have continually been cut, but the UAW at least was fighting in the negotiations to give them a better deal. Can you kind of talk about? I mean, that's a problem if you're going to be in a union and pay your union dues, but they could kind of just abandon you upon retirement.
And that was one of the things that got Shawn Fain elected, was that he was fighting back the corruption in his union to make sure that the benefits didn't get diminished, or there weren't tiered benefits, that you weren't giving the newcomers coming in lesser benefits or inferior benefits to the seasoned workers. And you should be promoting equity, right? That everyone should have basically the same thing. If you're going to provide healthcare, why should you have worse healthcare than me? This was huge to watch, and how popular he got in fighting for those benefits. In New York City, we say we're a union town, and a lot of us are very frustrated by this. We are union. I have a labor relations degree. I am union, but I am not happy with how today's unions in the city have been negotiating away benefits. It's concessionary bargaining. I'm not saying that they always have to be at war, but they should have put up more than a fight. If they had to wake up a sleeping giant in the retirees who were trying to enjoy their golden years and all of the fruits of what they worked for during their decades of service for the city. We always say, we built this city after 9/11, we rebuilt this city, and we built our unions. Our unions should never have diminished our health benefits to finance themselves. When the city came to them, they should have said, kiss my rear end on Times Square, because we're not going to give up our people. But what they did was, you're right, they did put us in a very vulnerable position that we had to say unions under the law do not represent retirees. But all I'm basically saying then is, if you're not going to protect me like you're supposed to, recognizing you are a retiree in training and will one day be us, you're then allowing management to screw us all on their own. So they've turned into corporatists rather than union leaders. And so we're going out on the street just about every month, reminding them. We literally did an Occupy DC 37 where we went from City Hall in Manhattan on Broadway down several blocks to Barclay Street, and we sat in the lobby of DC 37 for several hours because the executive director there, Henry Garrido, decided to hold a meeting with the city council why they shouldn't support our legislation to protect our Medicare without inviting us to the meeting. So we decided to show up with a billboard truck, 100 retirees, Shirley Chisholm posters, and a seat, and a collapsible seat. And our poster said, as in her name, she always said, if they don't give you a seat at the table, bring a folding chair. And we did.
And, I'd like to ask you, I mean, just psychologically, in other cultures, it's supposed to be the same in America. I was taught respect your elders and honor your elders. In other cultures, significantly to honor your elders. But here, I mean, this basically sounds like, I don't know if you remember back in the day, those commercials, Paul Ryan, throwing Granny off the cliff. But this sounds like the government, in deference or working with the health insurance industry, is throwing Granny and Grandpa off the cliff. I mean, what does that say about the state of America?
That is extremely disappointing, and we've long said that too. There is a saying that's attributed to Mahatma Gandhi that goes, the true measure of any society is found in how it treats its most vulnerable population. And this would be this population. To like stealing candy from a child, right? Why would you take from people in their most vulnerable part of their life, something that they need to survive? Healthcare. That's how we feel about that. This fighting this has been eye-opening, that in the 4 years that we're fighting this, because we're in 2025 now, and we started, literally our first lawsuit was August of 2021, in the middle of a pandemic, mind you, literally not having access to people. We formed a group and fought this from our homes on social media is how we started, against the very people that were supposed to protect us, that we were loyal to for decades, paid dues to. And then the international, AFSCME International, this is a killer, Jordan. This is the parent over DC 37 in New York City. AFSCME went and put the Retirees Association affiliated with DC 37 into administratorship, partly for protecting us. They were sending us a donation of like $1,000 a month towards our litigation, which has run into millions of dollars. And we've been grassroots fundraising it the way we were taught by true union leaders to do this. But because the International, under Lee Saunders, didn't want the executive director to, take any heat on this, they put the Retirees Association under administratorship, removed all the volunteer retiree officers, and put in his own people.
Unbelievable. What are the next steps, and what could people do to support your cause? Because you mentioned how expensive the legal has been.
Yes, it's tremendous. So we have an event coming up this Friday in Manhattan. It's starting at 250 Broadway, where the city council offices are. We're starting now a tour of going to every city council member's office and asking them where they stand. And we're making this a mayoral issue. If you want to be mayor or city council in our city or state, you want to take a job working for the people, then the people need to know where you stand on protecting traditional Medicare from being privatized, and where you stand on protecting a retired unionist's benefits in retirement. I shouldn't have to come back out of retirement in order to fight for something I already earned. The financing is grassroots, and there's two organizations. There's mine, NYC Retirees, and then there's the transit workers. So two separate groups. And our website is nycretirees.org. We are a 501c5. Donations to us are not tax deductible. The IRS would not grant us a charitable status. So we are 501c5. And our donations could be done right through our portal on our website. You can also sign up for our newsletter. The other organization is the transit workers. They are TWU100R, and their website is TWU100R.org. And you can donate to them through their website as well. They have a P.O. box in Brooklyn. And they have a separate website as well and a Facebook page too. So these are the two groups right now that are my focus, because they are a smaller group, and they went to court in June and their judge still has not given them a decision. And their people are struggling right now, being forced into this MA plan. And their union president is Richie Davis, TW Local 100 in Brooklyn. Richie is adamant that he enhanced their Medicare and doesn't think that they have a right to have access to all doctors and hospitals in America. It's okay. Doctors come in and out of the network. Just go find another doctor. It's a complete disconnect from common sense, where we fought for our entire life for continuity of care, and where you could be in your 70s, 80s, or 90s and had a doctor that's treated you your entire life. And as you and I hear all the time, these medical facilities around the country not any longer accepting Medicare Advantage plans because of the prior authorizations and all the other trouble that they're going through. The administrative burdens of fighting for an insurance company to approve care for someone that if this was in traditional Medicare, they would never have had this fight. This is what the burden is.
Absolutely. We'll put the links to those under the video. So if people got a few bucks, donate to Fight Goliath, which, and by the way, it's not just Eric Adams doing this. This kind of stuff is happening all over the country.
Yes, it is.
Also federally. So it will affect you, even if you're not elderly yet. If you think you're going to get Medicare when you're older, this is the kind of stuff they're doing. Thank you, Marianne. You're the president of the New York City Organization of Public Service Retirees, and we'll stay in touch.
Thank you, Jordan, for having us. Have a great day.